So what is meningitis? First thing, inflammation of the meninges. What is encephalitis? Inflammation of the brain parenchyma. But in practice, we do see that they come in hand together. You do not have a classical symptom of meningitis separate or an encephalitis separate. You usually have a symptomatology or a syndromal diagnosis of meningoencephalitis. So this meningoencephalitis is classified as acute, subacute and chronic. So acute occurs over a period of few hours to week, subacute occurs over a period of weeks to months, and chronic is they'll be having one dull aching fever with mild headache and mild sensorium changes for a period of months to years. So symptoms we saw: fever, classical, headache, altered sensorium, seizures, meningismus or neck stiffness. But this meninges or neck stiffness is not found in almost all the patients. And secondly, to detect in an ICU patient can also be sometimes difficult. Third thing, it is subjective to each one. And then you can have confusion, disorientation, cognitive changes. In fact, patient can present to you in a florid coma state. Etiology. Etiology of acute meningitis is very important for you to understand like what it can be, what is the most common bacteria and what is your targeted antibiotic there. So usually there are three bacteria: Streptococcus pneumoniae, Neisseria meningitis and Haemophilus influenza, which are predominantly seen to be causing meningitis. All these three organisms have not gone into that resistant pattern. They still do respond very well to our penicillins or cephalosporins. This is mostly for a community acquired meningitis, that is Streptococcus pneumonia, Neisseria meningitis and Haemophilus influenza. If you are considering something in an immunocompromised or a patient with an age of more than 60 years or with some T-cell immunity problem, always have a diagnosis of Listeria monocytogenes also in your mind. Other than this, thinking of a gram-negative bacilli or an MRSA or cons, you should always think of a hospital-acquired meningitis or a meningitis secondary to some neural surgery, that is post-operative complications, skin and subcutaneous tissue complications, or there is another source sitting somewhere wherein the bacteria has migrated. Coming to virus, definitely HSV holds the first one. Unfortunately, we have a treatment for HSV. Influenza, HIV in people with PLHA with a decreased CD4 count, mumps, rabies, coronavirus. Fungus and parasites are very rare to find. Especially you see them only in immunocompromised patients like people living with HIV AIDS or people with very much highly immunocompromised in organ transplant patients. You do see some candidal meningitis or to some extent in parasites like Naegleria fowleri or Angiostrongylis cantotennis can be seen. So in general, if you want to divide or want to know the most common organisms, if it is pediatric, age less than 1 month, it's not like adults. The pediatrics do not behave like adults. They have an entire spectrum of gram-positive, gram-negative, candida, like anything can happen in pediatrics. So the organism spectrum in pediatrics is wide variant, coming from a GNV to a gram-positive as well as pneumococcus and fungus. Whereas in children from 1 month to adults of up to 5 years, as discussed earlier, it is Streptococcus pneumonia, Haemophilus or meningococcus. If considering elderly, alcoholism or an impaired cell-mediated immunity, think of Listeria. GNV also can come sometimes in them, or if there is a hospital-acquired infection. If you happen to see a fever with rash with an altered sensorium, keep an atypical organism in the mind like rickettsiosis and also meningococcal meningitis.